Like the cost should be minimized. You know, recently in India, Pradhan Mantri's scheme is there, no? That is Arogya Seva scheme, and also our state government, Rajiv Gandhi's Arogya scheme. Through these schemes, no, they are trying to minimize the healthcare cost and affordable for the common people. We wanted to contribute in that, in line with those two schemes also. So I request all my members from the media to support us, to cooperate in such a way that we are going to make it as a big success. Thank you. And my colleagues are going to answer if any questions or they are going to talk. So, thank you. Recently you must have been seeing that, no, Honorable CM announced that every corner of the state they announce for the different pharma clusters. Like that many more, of course, schemes are required. Then definitely we can. So do you know that is equivalent to the present budget of the overall Telangana? Yeah. And also employment.
How much is that amount, you said? 10 years, how much are you expecting?
We are expecting about 25 to 30 billion itself, about close to 2 lakh crores, 1.5 to 2 lakh crores only from Telangana. So equivalent to that, there are the scientific pool already available. We have got the institutions, we have got the university, we have got the industry. So definitely.
So the industry is suffering from skilled labor, which is the
conclave in charge, Dr. Chakravarti and other members. Parthasaradhi మిత్రులందరికీ good evening. ఈ 73వ Indian Pharmaceutical Congress we are organizing from tomorrow. So this was first started in the year 1947. మనకి స్వాతంత్రం వచ్చిన దగ్గర నుంచి కూడా ఇండియన్ ఫార్మస్యూటికల్ కాంగ్రెస్ అనేది జరుగుతుంది. That is such a wonderful pharmaceutical scientist event. It is complete sessions. What are the developments ఏం జరిగినాయి ఇంతవరకు మన ఇండియన్ ఫార్మా? Further, what is the scope? What are the inventions in future? రాబోయే కాలంలో WHO చెప్పినట్టు ప్రకృతి వైపరీత్యాల వలన 10 మేజర్ డిజాస్టర్స్ ఆర్ గోయింగ్ టు కమ్. దాన్ని మనం ఎలా తట్టుకోవాలి? WHO has given 10 major threats to the globe in future on non-communicable diseases, on alcohol, tobacco, and gastrointestinal disorders, and coronary pulmonary disorders. These global threats ni మనం ఎలాగ ఛాలెంజ్ ఎదుర్కోవాలి, and what is the role of our Indian pharma? అందరికీ తెలుసు, హైదరాబాద్ is the hub of pharmaceutical industry, and India we are number 4 in the world. ఫార్మా రంగంలోకి మన యొక్క స్టాండింగ్ రేటింగ్ అండ్ ర్యాంకింగ్ is number 4 in the world. And we are number 1 in providing safe, effective and cost-effective drugs. That to Hyderabad is the major contribution of Hyderabad pharma industry in providing cost-effective drugs to the society. That is one of the major contributions. అలాగే ఈ కాంగ్రెస్లో 8,000 మంది స్టూడెంట్స్, అదేవిధంగా ఇండస్ట్రీ నుంచి మోర్ దెన్ 2,000 పీపుల్ ఆర్ కమింగ్, అండ్ విదేశాల నుంచి 25 స్పీకర్స్ వస్తున్నారు. దే వాంట్ టు ఎక్స్ప్లెయిన్ ద న్యూ ఇన్వెన్షన్స్, దే వాంట్ టు హ్యావ్ ద ఇంటరాక్షన్ డ్యూరింగ్ ది సైంటిఫిక్ డెలిబరేషన్స్. అదేవిధంగా లోకల్గా 48 మంది స్పీకర్స్ని ఐడెంటిఫై చేశాను. టోటల్గా 74 మంది స్పీకర్స్ 3 రోజుల సైంటిఫిక్ డెలిబరేషన్స్లో పాల్గొంటారు. ఫస్ట్ టైం ప్రెసిడెంట్ గారు ఈజ్ వెరీ మచ్ పర్టికులర్ అబౌట్ ద స్టూడెంట్ బెనిఫిట్. స్టూడెంట్ షుడ్ గెట్ సమ్ బెనిఫిట్ అని ఆయన ఫస్ట్ నుంచి కూడా అడిగి ప్లేస్మెంట్ కాంక్లేవ్ అనేది పెట్టడం జరిగింది. ఇంతవరకు స్టూడెంట్స్ పాస్ అయిన తర్వాత జాబ్స్కి రకరకాల కంపెనీలకు తిరగడం, కొన్ని ప్లేస్మెంట్ ఖాళీలు ఉన్నాయడం, ఇలాంటి ఇబ్బందులు పడుతున్నారు. ఈ ప్లేస్మెంట్ కాంక్లేవ్ పెట్టడమే కాకుండా రేపు ఫస్ట్ డే స్క్రూటినీ చేసుకుంటారు కంపెనీ వాళ్ళు. బై వాల్డిక్టరీ దే వాంట్ టు గివ్ ద ఆఫర్ లెటర్ టు ద స్టూడెంట్స్. దట్ ఈస్ ద ఇనిషియేషన్ టేకెన్ బై అవర్ ప్రెసిడెంట్ Parthasaradhi garu. That shows his affection toward the students, particularly students community. అదేవిధంగా all the 3 days we are providing all the local logistics, food, breakfast, lunch, dinner అన్నీ కూడా ఆర్గనైజర్స్ మేము ప్రొవైడ్ చేస్తున్నాం స్టూడెంట్స్కి. సో ఎక్సలెంట్ హాస్పిటాలిటీ వీఆర్ గోయింగ్ టు గివ్, దట్ ఇస్ వన్. నెక్స్ట్ స్టూడెంట్స్కి దీంట్లో స్టార్ట్అప్ సెషన్ అనేది ఒకటి ఇంక్లూడ్ చేస్తాం. ఇది కూడా సజెస్టెడ్ బై సార్. సో ఆల్ ఇండస్ట్రీ ఎక్స్పర్ట్స్ విల్ బి దేర్. స్టూడెంట్ విల్ కమ్ విత్ ఎన్ ఐడియా. Suppose if the idea companies likes, they can fund that boy for further research in that area, startups. And pharma entrepreneurship అనేది ఇంకొక సెషన్ పెడతాం స్టూడెంట్స్కి. So that we want to bring some more entrepreneurs from pharmacy. These are some of the highlights of the Congress. And totalగా 26 sessions, scientific sessions ఉన్నాయి.
Yes.
And 26 చైర్మన్లు, కో చైర్మన్లు, 74 మంది స్పీకర్స్, తర్వాత 125 మంది గ్రాడ్యుయేటర్స్. 2975 పేపర్లు వచ్చినాయి సైంటిఫిక్ అబ్స్ట్రాక్ట్స్. దాన్ని స్క్రూటినీ చేసి మేము 2500ని యాక్సెప్ట్ చేసాము. అది దే ఆర్ గోయింగ్ టు డిస్ప్లే ద రీసెర్చ్ వర్క్ ఆల్ ద స్టూడెంట్స్. వాటి నుంచి బెస్ట్ పేపర్స్ 100 సెలెక్ట్ చేసాము, బెస్ట్ వారం. దాని నుంచి ఫస్ట్ ప్రైజ్, సెకండ్ ప్రైజ్ కూడా ఇద్దామని చెప్పి one of the best oral presentation with the cash prize we are going to give. అదేవిధంగా కల్చరల్స్, ఎవ్రీథింగ్ we have not hired the professionals, students only participating and they are organizing. More than 500 volunteers, pharmacy volunteers, students, they are working day and night to make this event a grand success. So my sincere appeal and request to all our press and media friends, please promote this in a big way, because this is the biggest congress of the Indian Science Congress. This is the biggest conference by any organization. So Indian Pharmaceutical Association is the host. We are organizing. I am the president for the Indian Pharmaceutical Association. So I request all of you to give a wider publicity and make this contribute yourself for the success of the Congress. Thank you very much.
Streamline to work in an efficient manner, to harmonize, to take care of the equitable access, affordable quality medical products, to promote global health, global well-being. That is the reason why the 73rd Indian Pharmaceutical Congress, the theme is Role of Indian Pharma for Global Well-being. With the support of Dr. Parthasaradhi, we have taken in such a scientific way in order to promote access, at the same time patient-centric effects to achieve patient safety is very, very important. So not only as a regulator, but as a true scientist, come a regulatory scientist, if I can share my thoughts, this Congress is very, very important, and it is going to be a very significant event to encourage young scientific mind people, because being a pharma capital, because bulk drug capital of India, Hyderabad is known for bulk drug capital of India. Second, Telangana is known for the vaccine capital of the world. Every alternate minute, the whatever vaccines are being administered to the children, that vaccine is being produced from our country. So it is a great pride. And World Health Organization, UNICEF, the total immunization program, if you see, 65.75% of the global vaccine supply from India. So that is the pride of our entrepreneurs. And in our Telangana, we are having a biggest cluster in Genome Valley, where we are taking care of for the development of a lot of biological products, not only human vaccines, even biosimilar products, follow-on biologics, what we call regenerative medical product, cell therapy, gene therapy, tissue engineering products. As a expert committee advisory panel member, I was the only one person nominated from entire country. Yes. We are representing 65 countries globally with respect to how to promote the access and high quality biological products. Next feature is biology. So we have kept separated two tracks in our scientific program. 65 speakers already identified with the support of our scientific team, Dr. Vikramarka and Sridhar Ramkishan, our Sumalata Madam and Vadlamudi Rao. They have worked night and day, Dr. Sridhar. So we have taken in such a way that it should be useful to the industry, academia and the regulatory people. So this is our important focus for tomorrow's program, and we are thankful to Government of Telangana, and with the support of our President Parthasaradhi requested the Honorable Chief Minister of Telangana, in principle agreed. Tomorrow sir is going to inaugurate, and 4 cabinet ministers and our union minister for mining and all, Dr. Kishan Reddy Sahab is also attending. So lot of galaxy of people from different streams attending. So we need blessings, and you are the people where you can promote globally without compromising and without exaggerating the statistics. Forget about statistics, patient safety and all. Ultimately, we are all working for the international health. We are all here, but at the same time, please promote and for the benefit of all student fraternity, industry representatives and regulatory framework. Thank you very much for giving me the opportunity.
President of this prestigious Congress, under the guidance of the National President of IPA, Dr. Narayana Garu, LOC Chairman Dr. Ramkishan, and Secretary our own Giri Garu, and other members like Narayana Garu, Garu, etc. So the reason I am here, I am representing a Federation of Pharma Entrepreneurs. It's also a national body. Around 650 industries are there with us. I am chairman of APM Telangana and also the National Board of Organizing Committee as a senior vice president on the national board. Today I am so happy. Let's be very positive on that. Ratna, I'll come to you, your question also a little bit. What is happening? It is not a congress, it is not a conference. It is a big festival of pharma and healthcare and life sciences. We are so happy it is happening under the guidance of our own Parthasaradhi. Because imagine, this is a culmination of 5 sectors. It's the industry, regulatory, hospitals, you have a community of pharmacy. What's the power people?
Yes.
There are 5 wings. 5 wings coming together. We talk about the academia and industry coordination. I think in this Mela, it is a big way it is happening. We always talk about it. And after 10 years it is happening. And none other than our Chief Minister and the host of plethora of ministers are also coming. We have some ministers from other states also maybe coming in the 2nd day and 3rd day also. It's a big positive vibe for the Telangana pharma. That's what I wanted to emphasize on that first guy. And the second thing, we all know actually in US when the drugs are prescribed to patients often get confused actually. 90% of their prescribed medicines are generics. Okay, and most of them are from India only. We talk about less efficacy, the spurious drugs, less quality drugs, etc. from our India, because few incidents always pop up and they get identified and they get the media attention. No wonder, because we always vie for 100% quality audit. There is no 99.9% compliance, we all agree. But at the same time, why very high regulatory markets like USA, Europe and America, they are all buying from us for their own. And do you know one more statistics I tell you? Our own medicines are reducing the burden of the healthcare on the US economy more than $300 billion, out of which 40% is from India only. And can I say one thing? Dr. Parthasaradhi never speak about himself, because he is one of the pioneers along with Dr. Reddy together. We all look at them. You know, tens of lakhs of people, millions of people are dying for Federation of Trade, Telangana. I travel along post-COVID also I travel a lot of countries, including USA and South America and Brazil and other, even African countries also. They're all looking at pride. I receive a lot of respect there, being an Indian. So what is happening, I do understand there are few flaws, and that is the reason our own the drug regulatory department, under the guidance of Dr. Rajiv and the National Drug Controller like Ramkishan and the entire team, they are working on it, upgrading the skills of upgrading the facilities, etc. Even further also government is hand-holding them. I think that is happening separately. Let's not really bother about it. Unless our drugs are efficacious, why people should buy? 215 countries are still buying. Our exports are going. In fact, it is 26 billion. It is not. It is increased already. This is the only area 11.5% double-digit growth, where world pharma is going in either negative or 1 to 1.5%. So our drugs are being valued at a very high. Cocktail drugs like HIV and all. You know, millions of people lives were saved during 90s when the innovative drug was costing more than $15,000 US. The Cipla sold around 350 with the help of UNESCO. So our own Indian companies. And here the vaccines, I don't need to elaborate that. We developed, everybody was looking at it. India, I think half of the Indian population will wipe away during COVID because they are not prepared. But we proved the world wrong with our own preparedness. There was never not even a single company which was making a face mask during that time. And then we became the world supplier of face masks after China during this. So India has already no dearth of knowledge and the initiation, and we all proved it. Be it vaccines, the first line of defense medicines, be it azithromycin or the first line of medicines, which when the COVID coronavirus is in the first stage, we are protecting the people's lives with a lot of remdesivir and all. We are world producer. We produce to world. Everybody was looking at us. We supplied to, as sir said, more than 150 countries.
Yes.
So wherever I went, because after COVID I went to at least 30 countries. Wherever I went, we received a very good reception there. And our drug control department now is in association with Inter. They already have MOUs with Dutch, Netherlands, USA. Dr. Robert Colley, US FDA chief, he is the in charge of allowing the drugs to their country, most highly regulated country. We are in regular touch. In fact, he is in touch with me on my WhatsApp also. He is in touch with everybody in the industry. So things are moving very positive. Let us concentrate on that. Culmination of 5 wings: healthcare, regulatory, industry, academia, pharmacy. Everybody is coming together. It's such a big event. I think we first focus on the positivity of it. And as sir said, Telangana government is very positive to take the pharma and healthcare industry forward. Soon we'll have a lot of medical tourism. Everything is happening. It's going to be a big boost for the industry also. Let's carry it forward and spread this word of positivity. I humbly request all the media people, next 3 days, make best use of it. And as he said, it's the best use for the employment generation and also a platform for big innovation, showcasing and unveiling new innovations also, because the healthcare is completely changing. It is going to be a preempting. It's not just cure alone. It is preempting. So before the disease comes, we already envisage what disease is going to come, and we are going to give the medicines. After diagnosing, cell therapy, gene therapy, everything is on the anvil. And Hyderabad stands first with the visionaries like Parthasaradhi Garu and all other CEOs. Tomorrow we have a CEO roundtable also. They gave me the opportunity to conduct a roundtable to get the insights from them, to lay the way forward for the industry also. I think with this positivity, I want you all to take it forward in a big way. Thank you.
Hello, hi, andarki namaskaram. Nenu me Lakshmi Manchu. So you're watching me on City Light E-News. Don't forget to share, like and subscribe.
హాయ్ అండి, నేను మెల్ల నరేష్ మాట్లాడుతున్నాను. ప్లీజ్ సబ్స్క్రైబ్ టు సిటీ లైట్స్ ఈ న్యూస్.
Hello everybody, Andarki Namaskaram. This is Anusya Bharadwaj. Please subscribe to City Light E-News. Thank you.
Please subscribe to City Light E-News.
హలో నేను మీ రాశి సింగ్. సబ్స్క్రైబ్ టు సిటీ లైట్.
హలో గైస్, నేను మీ అశ్విని. సో సిటీ లైట్ ఈ న్యూస్కి సబ్స్క్రైబ్ చేసుకోండి. ఇక్కడ చాలా మంచి ఎక్స్క్లూజివ్ కంటెంట్ దొరుకుతుంది మీకైతే. సో గో అండ్ సబ్స్క్రైబ్ ఈ న్యూస్ సిటీ లైట్.
హాయ్, నేను శ్యామల. ప్లీజ్ సబ్స్క్రైబ్ సిటీ లైట్ ఈ న్యూస్.